I'm going to start with range of motion of the elbow. Now I want you to flex your hand and extend. I want you to flex your wrist and extend. Now I'm going to palpate her brachial artery. Brachial artery is present. Her radius pulse, her brachial pulse and her radius pulse. Radius pulse is present. Now I'm going to check for reflexes. Now I'm going to check for brachial radial reflex. Relax your arm. Okay. So reflex is present. Her bicep reflex. So her bicep reflex is present. Now her tricep reflex. Relax your arm. Tricep reflex is also present. Now I'm going to inspect the posterior of her chest wall. So the patient her chest wall is symmetrical bilaterally. I'm going to palpate your spinal process for any pain or tenderness. Do you feel any pain or tenderness? No. There is no pain or tenderness. There is no sign of sclerosis. No curvature is noted. There is no bulges into the inner spaces of her spine. Now I'm going to assess her thoracic expansion. Okay, and I want you to breathe for me. I want you to breathe. Okay, so her spine is able to expand. Her spine is able to expand. Now I'm going to check for tactile firmities. Say 99.
99,
Okay.
99, 99.
Vibration is heard throughout her back. So now I'm going to percuss her posterior chest wall. So normal residues is heard throughout her chest wall, indicating absence of peripheral infusion. And now I'm going to assess her costal vertebral angle. Tell me if you feel any pain, okay? Do you feel any pain?
No,
Do you feel any pain?
no.
There is no pain or tenderness that is noted, indicating absence of any kidney infection or kidney disease. Now I'm going to listen. I'm going to listen to her lungs. I want you to breathe for me. I want you to lean forward a little bit. Breathe. I want you to take some deep breaths. Breathe. Breathe. So there is no crackles, or wheezes that is heard over her lungs field. And now I'm going to go back to the anterior chest. So patient anterior is symmetrical bilaterally. There is no signs of deformities or no abnormality is noted. There's no abnormality is noted. Now I'm going to do the same thing that I did at your back, okay? Now I'm going to check your thoracic expansion. Now I want you to breathe deep for me. Take another breath. So patient lungs is able to expand bilaterally. It is symmetrical. Now I'm going to do the tactile firmities and say 99.
99, 99, 99.
Okay, vibration is heard throughout her lungs. Now I'm going, vibration is heard throughout her lungs. I'm going to instruct the patient now on a uh, breast self-examination, and I will tell her to prepare her breast in a circular motion and report any discharge or lumps or bumps that is felt in her breast to her doctor. Now I'm going to inspect her maxilla. I want you to lift your arm. There is no rash or redness. I'm going to palpate her lymph node. There is no sign of inflammation to her lymph node. There is no sign of inflammation to her lymph node. Now I'm going to listen to her apical pulse. So I listen to apical pulse for 30 seconds and it's 37. So I'm going to multiply that times 2. And there is no extra sign her S1 and S2. Her heart is in a normal rhythm. Now I'm going to have you lie down. I'm going to, okay. I'm going to auscultate her abdomen. I'm going to listen for vowel sound. So bowel sound is present. Patient bowel sound is present in her abdomen is symmetrical bilaterally. Her skin color is evenly distributed. There is no lesions. There is no redness. Her umbilical is inverted. The skin surrounding her umbilical is dark in complexion due to the patient race. Now I'm going to listen for any pulsation in her abdomen. So there is no pulsation indicating absence of aorta aneurysm. Now I'm going to do a light palpation of the patient abdomen. I'm going to start with light palpation. Do you feel any pain or tenderness?
No.
Now I'm going to start with deep palpation. Do you feel any pain or tenderness? So there is no pain or tenderness that is noted. Now I'm going to percuss her abdomen. So tympanic sound is heard throughout her abdomen, which is normal. indicating absence of any enlarged organ or masses in her abdomen. And her contour is round and smooth. I want you to cough for me. There is no sign of hernia noted. Now I'm going to prepare her inguinal lymph node. Do you feel any pain or tenderness?
No.
There is no inflammation, there is no pain or tenderness that is noted. Now I'm going to, if you're a male patient, I will instruct the patient to do a testicular self-examination and report any change in size to his provider, the healthcare provider. Now I want you to sit up. Okay, we want to do your lower extremities. Okay. I'll go back now. Sorry. Now I'm going to prepare your hips. Your hips join. There is no crepitus. There is no crepitus. Now I want you to flex your legs and flex them. Bend your legs. Okay. Now I want you to extend them. I want you to touch your kneecap with your heel. Okay. I want you to invert. Okay, the other way. To extend. To extend. Like that. And then the other way. Like that. Okay. I want you to sit up. Okay, so now I'm going to do a range of motion of her heels, of her kneecap. I want you to flex your leg up a little bit and extend them. Extend and flex and extend. And I'm going to check for reflex in her patella. So reflex is present. I'm going to do the same with her ankle. Reflex is also present in her ankle. Now I'm going to do, I'm going to prepare for her tibial pulse. And her pedal pulse. Her patella pulse. Okay, now I'm going to have the patient to stand up for me. Okay, now I want you to walk on your heels. I want you to walk on your heels. And now go back, walk on your toes. And come forward on your toes. Okay, I want you to do the rainbow test. So I want you to stand still with your feet together for the rainbow test. And I want you to cross your hand and try to lean side to side. So the patient gait is steady. There is no sign of imbalances in her gaits. Patient is able to complete her rainbow test without any problem. Now I'm going to perform sensation to her lower legs. I want you to just sit back up and just tell me what you feel, okay?
Sure.
The patient is able to identify sensation in her lower extremity. Patient is able to identify in her lower extremity. Now I want you to close your eyes and tell me what you feel.
Vibration.
Patient is able to feel vibration in her lower extremity. So this will be the end of my assessment, and please let me know how I did. Thank you.